Hi, I'm Dr. V. I'm Chief of the Spine Pain Program at Bloor Pain Specialists, and today I'm going to be talking about MRI.
Should I be concerned if my MRI result mentions stenosis? What can I do to help symptoms?
That's an excellent question. Knowing your own anatomy is extremely important, and that is the important part. Concern is relating to your function. Having a diagnosis of stenosis alone without symptoms should not lead somebody to have concern. But they should remember, they should be aware of their baseline anatomy, just in case they have a future injury or develop symptoms in the future, so they have some reference point as to what might be causing their future symptoms. If somebody is symptomatic in a discomfort sort of state without any emergency sign, without any loss of function of their nerves, they don't have to be concerned in the urgent sense. But they should really be aware of their bodies, their anatomy, their MRI findings, because they do often get worse with time. So they'll need to engage in rehabilitative efforts to strengthen their backs, to stabilize their spines, so that they prevent additional wear and tear and worsening of that narrowed space, that's stenosis itself. So a lot of the rehab efforts will help slow down these processes and often pull people back from symptomatic to asymptomatic. That is the baseline therapy, and it is effective for the vast majority. Outcomes favor exercise more than just about any other therapy. Some medical management options exist, but their outcomes are rather poor, and we'll cover that in a different video on medical management of back pain, another one on osteoarthritis, and a third one on medical management of neuropathic pain or nerve pain, which will result from stenosis. And medications tend not to do their job very well with high likelihood of adverse effects. We can do procedures, do epidural steroid injections. If those are effective, they can be repeated far down the line. But if not, we don't repeat something that doesn't make sense. It doesn't actually improve this patient's symptoms. And while it improves one patient, it may not improve the next, and it might be wonderful for the third. And we can use radiofrequency energy to either ablate small branches to help somebody move a painful joint associated with the stenosis, or we can use radiofrequency energy to pulsate at the nerve roots so they're less sensitive of the impact of those surrounding structures pinching upon them. Those are options there, but surgery also remains an option. Thanks for watching today's video. Please like and subscribe below. If you have any questions that you'd like us to address in a future video, please leave them in the comments area. If you want us to answer any questions about your care specifically, please contact the clinic directly.